Is fever a symptom of COVID or is it a symptom of the flu? Well, if you're thinking, wait a minute, it's a symptom of both. Well, you're exactly right. It is a symptom that overlaps both COVID and the flu. And in fact, there are a number of symptoms that overlap both conditions. It's one of our concerns as doctors. We are concerned going into the flu season that if you come in with a fever and many other symptoms, how will we know if it's COVID or if it's the flu? Let me give you a few other symptoms that also overlap. We've got cough. You know that. You know that COVID can have cough as well as the flu. Shortness of breath. Absolutely. Fatigue, sore throat, and runny nose. All of those can overlap both COVID and the flu. But not only that, you can also get muscle pains or body aches, headache, and some people also have vomiting and diarrhea or other GI symptoms. All of those can be symptoms of COVID or the flu. So you say, well, what is a difference? Well, symptoms that could distinguish COVID from the flu are loss of taste or smell. That's right. That's a defining symptom of COVID that we don't typically see with upper respiratory infections and other conditions like the flu. So a change or a loss of taste or smell definitely is a warning sign that you may potentially have COVID. But you see, guys, how many of these symptoms actually overlap. Fever, cough, shortness of breath, fatigue, sore throat, runny nose, muscle pains, headaches, even GI symptoms such as nausea, vomiting, diarrhea, things like that. So this is really important. It's another reason why we want you to get your flu shot this year. We don't want to be in a position where we're trying to figure out whether you have the flu or if you have COVID. A couple other things to keep in mind between the flu and COVID is that they tend to be spread roughly the same way. That's person-to-person contact, and the spread of upper respiratory droplets. That's the droplets that fly from our mouth and our nose and things like that when we are close to each other, when we're talking, speaking, things of that nature. A few other things to keep in mind is that with the flu, symptoms typically start anywhere from 1 to 4 days after infection. This is a little different with COVID. Symptoms start probably on average around 5 days or so after being infected, but actually symptoms can occur anywhere from 2 to 14 days after being infected. It's actually one of the reasons why when we say to quarantine, we say for 14 days, because we know that infection, or rather symptoms, can develop up to 2 to 14 days after getting infected. We know that both the flu and COVID can cause additional complications, right? Pneumonias and other things that can happen as a result of the flu or COVID, right? You can get more severe illness. I would say something that's different with COVID-19 is that we've heard about people getting blood clots, not only in their veins and arteries, but in different organs, their lungs, their heart, etc. Also, there's this multi-system inflammatory syndrome in children, this Kawasaki disease-like syndrome that's been happening in kids that we think is a consequence of COVID infection or a sequela potentially of COVID infection. That is different than what we have seen traditionally with the flu. So there are some differences, but guys, there are a lot of similarities. Once again, I do want you to get your flu shot. Very, very important this year. It's important every year, but this year may be more important than ever. Guys, please share this video with others. I do daily health videos. Please like and follow my page. And if you're interested in sending stars, I answer your questions first, guys. I'm Dr. Jen Caudle.